Good morning, everybody. It's a great pleasure for me to be part of these important activities. It's a pleasure for me to speak about challenges in diabetes management in Africa. I have no conflict of interest with this presentation. My presentations are three aspects: epidemiology, challenge in diagnostic, and also challenge in management. According to epidemiology, diabetes around the world between 2021 to 2045 with great prevalence in the world, but generally in poor countries, especially in Africa and also in Southeast Asia. What about this in Africa? The high level of diagnosis, cases, complication, financial, social, and human costs, few specialists, educators, dietitians, and pediatrics, and inadequate healthcare facilities. Also, registry and national program very with great disparities and also lack of health insurance. Urbanization and physical inactivity lead to a high prevalence of obesity and also of diabetes and cardiovascular disease. When considering obesity and social or society environment, we notice that traditional considerations and also education is a great problem with some ceremonies in Africa, means Awulaba, for example, in Ivory Coast, means Jugoma in Senegal, and Queen Anna in Benin. This obesity and overweight is the leading cause of high prevalence of diabetes, which may reach 30% in Tanzania, also in South Africa, and in Seychelles. And considering this situation, the level of death of from diabetes is in front of the death of HIV, AIDS, tuberculosis, and also compared to malaria. What is the challenge in diagnostic? In front of a newly diagnostic diabetic, you may ask three questions. Are we in emergency situations? Are we in front of curable diseases? Or are we facing that typical diabetes with specific treatment? Atypical diabetes, the so-called ketosis-prone type 2 diabetes mellitus in frontier with type 1 diabetes and also type 2 diabetes with sometimes a very difficult situation to have a great of a real diagnostic because it's not evident for access to immunogenicity. And at the other hand, the malnutrition related to diabetes mellitus is another challenge, and you may face to identify phenotypes, characteristic, and class type of diabetes. This malnutrition related to diabetes mellitus is seen in different situations. The early onset of diabetes, the body mass index, the history of poor nutrition in utero and early childhood, the severity of diabetes, and the insulin requirement of a high level, and also the absence of ketosis, as you may see in these men in our clinical setting. When you see this map, you may see this type of patient seen in Jamaica, Brazil, Peru, and generally in sub-Saharan Africa and Southeast Asia. Because of this situation, an international consensus meeting on atypical lane diabetes has been put in place in India in January. And we continue this discussion with this group during the Congress of International Diabetes Federation in Bangkok, and also during American Diabetes Association annual scientific session in Chicago. A part of this atypical form of diabetes, we have also infectious complications such as tuberculosis and HIV, which may lead to cardiovascular diseases, obesity, and high level of mortality, even in treated patients. The diabetic foot is also another challenge because of infections in our context. And in front of this situation of diabetic foot infection, we have also the diabetic, and it may lead to an amputation also. And the level of amputation may reach 30%, and sometimes this amputation is concerned with two legs, and with high level of amputation, high level of amputation, and also handicap. Now let's move to a challenge in management. Education in Africa is complex, very complex situations. And in the past, the conversation map tool was a very, very important and interesting situations, important tools to educate people for diabetic foot prevention, also for other aspects of prevention of diabetes complications. Since the creation of insulin, 100 before, after, Africa is faced to this same situation, as availability and insulin cost is a great challenge. And as you can see, when use syringe of insulin and also other type of injection, we may face to lipodystrophy, and this lipodystrophy may cause a variability, instability of glycemic control. So we need to use this new technology of diabetes control. Unfortunately, the costs remain very high, and a very difficult situation, and our health insurance doesn't care about these situations. The global diabetes cascade of care in population-based surveys in 28 low and middle income countries between 2008 and 2016. When compared the population of diabetic people, the level of testing is low, the level of diagnosing, the percentage of treatment, and the percentage of control. Another challenge is the traditional treatment because of the cost of insulin, but also the cost of other anti-diabetic drugs. The glycemic index, the general consumed foods in our context, with fries, potatoes or fries, plantain, even in Thailand foods, the level of glycemic index is too high. We also, in this situation, carry out 3 important activities for Africa during the last 3 years. The first is Africa Diabetes Registry, the second training program, and the third African Diabetes Guideline. And the African Diabetes Registry have started in West Africa and should move to other parts of Africa to have better data for our continent. According to diabetes education program with the help of International Diabetes Federation, with our partners, a great program has been put in place and concern especially primary care physicians, general practitioners, nurses, dietitians, nutritionists, pharmacists, and other specialists. So, in conclusion, diabetes is a growing problem in sub-Saharan Africa. With late diagnosis and high mortality may lead to poor prevention at the top level. A typical presentation also is become higher, and the etiopathogenesis remain generally unknown. Organization of care, training, and research taking account soft partnership, but also north and south partnership. Thank you for your attention.